Hi, I'm Michael Marin. At Holy Name Medical Center, we believe that all citizens need to be informed about the important healthcare issues that affect their daily lives. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by Johnson & Johnson, Wells Fargo, Holy Name Medical Center in Teaneck, New Jersey. Healing begins here. PSE&G, committed to improving New Jersey's economy and strengthening its communities. Bergen Community College, New Jersey Council of County Colleges, and by MD Advantage Insurance Company of New Jersey.
Welcome to State of Affairs. I'm Steve Adubato, coming to you from the Agnes Veris NJTV studio in beautiful Newark, New Jersey. I promise you, Chris, it'll be better after this. Christopher Yu is Acting Insurance Fraud Prosecutor of the New Jersey Office of Attorney General. Good to see you, Chris.
Great to see you again, Steve.
You've been with us so many times in our other caucus programs, other CEC programs on public television. Talk to us about what insurance fraud is in the state.
So insurance fraud is multiple people trying to defraud the system and destabilize the system. All of us pay for insurance one way or another, whether it's health, whether it's auto, whether it's life. There are individuals out there who are pushing up our premiums and making it more expensive for us.
How do they do it?
So a lot of times you see whether they're individual beneficiaries who are defrauding the insurance industry through application fraud, overstating their wealth, overstating their health, or understating the risk that they have when they drive, saying they're the good driver when they're actually bad drivers.
And the role of your office is to detect it, protect citizens, and also, by the way, we're involved in a public awareness initiative with the Attorney General's office here, and to make people aware of what? Like, what do they do if they think they've been defrauded?
So I think we will fight on multiple fronts. We detect insurance fraud, we prosecute insurance fraud, and if we don't find a prosecutable case or we find that there is an actor that has a license, we can refer them to another agency for licensing action. Say there's a chiropractor who's defrauding the system. We can have his license revoked by another state agency.
The other thing that really struck me in getting ready for the show is one of the populations that seems particularly vulnerable to insurance fraud are those who are elderly.
That's absolutely right.
Talk about that. What are we talking about, and why are they so vulnerable?
So Attorney General Perino has a new program out, the Safe
Chris Perino?
Yes, the Safe Care Cam initiative.
Safe Care Cam?
Yeah, it's short for Safe Care Camera. So initially it started where multiple people, individuals of the public, were bringing us videos that they had taped of healthcare providers abusing or neglecting their elderly, either parents or loved one. He developed this program that we would lend out cameras through the Division of Consumer Affairs to, because they were very expensive, to tape healthcare providers that they think were abusing their family members. They're able to bring these tapes back into us, and if we find a viable case to prosecute, we will go forward.
Give us an example of, I don't want to say typical, abuse of someone who is elderly. But I was reading, there are several examples, for example.
So specifically, my office does work with the Medicaid portion, or people who are funded by Medicaid, or facilities that are funded by Medicaid. A lot of these individuals are put in very large rooms, neglected, not really taken care of, and when they want to use the restroom or sit in a certain spot, they're kind of pushed around or jostled, and a lot of them don't really understand what's going on. So healthcare professionals often lose patience, either strike them or hit them or push them, and those are the cases that we're trying to prosecute.
So let's do this. Jackie, do we have the number for the Insurance Fraud Prosecutor? We're going to put up the website as you talk. Someone thinks that they are a victim, family member, friend, they're suspicious. They go to the website. What happens?
Right. They can file a report anonymously with us, or they can give us a call and tell us what they think the issue is. A lot of times we have an individual come in and talk to us, talk to our detectives, explain what they think is the neglect or the abuse or the fraud that's being perpetrated on the system.
Chris, you were with us on one of our Caucus New Jersey programs. It was a round table. And I remember asking you a question I want to put out there again right now. Who's the victim here? Is it just the person or persons who are defrauded, who are in that situation? Because you said it wasn't. You said it was everyone else.
Right. You're
And
absolutely
what does that mean?
You're absolutely right. I feel that all of us are the victims of insurance fraud in multiple different ways. Either our premiums are higher because individuals are destabilizing the system, or you and I could be victims specifically. Say you go to your doctor and you need to get an MRI or a CAT scan or blood work, and your doctor's trying to push you to a specific vendor because he's getting paid to push you there. That vendor might be inconvenient for you, too far away from you, make you come back multiple times. It's our time, it's our money. We're all victims here.
Now, Chris, our producers do a great job of reminding me we go back and cover something. I did not make it clear how this elder abuse problem is actually an insurance fraud problem. So clarify for that.
It is. Many of the facilities that individuals go to when, as the population grows older, are covered by insurance or covered by Medicaid, ultimately. So we, as the citizens of the state, are paying into the Medicaid system.
So hold on. We're paying for a system that in certain cases, you have workers who are abusing elderly patients. That's a fraud on all of us.
Right. I feel it is a fraud on all of us, and it's two ways. Whether it's we're paying someone to do their job and they're abusing patients, or we're paying for services that are not being rendered. We're paying for someone to take care of our brothers, our sisters, our uncles, our aunts.
Devil's advocate. Someone says, hey, wait a minute. I went to my auto body guy, went to a chiropractor, he or she. They worked the deal out with me. So, Chris, why are you giving me a hard time if I'm on the other end and I got a deal because I got more treatment and they charged more, or they fixed my car and it was really a certain amount, but they charged another amount and they gave it to the insurance company? I got off. I got a good deal. You say?
I say that's fraud on multiple counts. You, as the individual, are trying to defraud the system. The auto vendor or doctor is defrauding the system. And at the end of the day, all of us are paying for insurance one way or another. Either our companies are paying for us or we're paying for it individually.
So hold on. My premium is going up. Someone else's premium is going up because somebody cut a deal with someone in an auto body shop to put in a fraudulent claim. They think, like, I got away with whatever. The rest of us are picking up that tab.
Absolutely. You think it's just you doing it? There are multiple people out there also trying to cut the same deal with the same vendor, cut the same deal with the same doctor, and it's destabilizing the system.
As we put up the website one more time, Christopher Yu, who is acting insurance fraud prosecutor, New Jersey Office of Attorney General, one more time, what should people be looking for?
So they should be looking over their benefit statements from their doctors to make sure that the services that they received are the services that they were billed, not overbilled. They should be looking at their insurance claims. If they're in an accident and they see that there are multiple insurance claims from multiple people who say they were in the other vehicle, they should be looking at that. They should be looking for anything that's out of the ordinary.
Number one challenge you face as fraud prosecutor is?
I think getting the message out to individuals that insurance fraud is a crime and it affects everyone. And that's why people like you, shows like yours, really help us get the message out there to the public.
Well, that's what public broadcasting is partly all about. And also, there's a 30-second spot, a public awareness spot that's out there as well. And go on that website to find out more about insurance fraud. Chris, thank you so much for joining us.
Thank you so much for having me.
This is State of Affairs. I'm Steve Adubato. We'll be right back. New Jersey is about to elect a new governor. This fall, I'll be sitting down with Democratic candidate Phil Murphy and Republican candidate Kim Guadagno. So what do you think the #1 challenge is facing New Jersey's next governor? Share your thoughts with me on Twitter @Steve Adubato. Do it now. Let your voice be heard, because democracy is not a spectator sport. We are pleased to welcome Leslie Anderson, Executive Director of the New Jersey Redevelopment Authority. Good to see you, Leslie.
It's great to be here. Thank you for having me.
For people who don't know what the authority is, tell them.
The New Jersey Redevelopment Authority is a state financing authority focused on New Jersey's most urbanized communities. We provide direct financial assistance to projects, and we also provide technical assistance to municipalities, nonprofits, and developers who are looking to redevelop their communities.
So I was looking at success stories, and one of them has struck me because IHOP is important to a lot of people in Paterson. So what is the role of the authority in IHOP in Paterson? Why would you get involved?
Well, initially I said no.
Well, hold on. Explain who asks.
The owner of the IHOP asked. And my initial reaction was no, because it took us out of our normal comfort zone. We usually do real estate development, but this particular IHOP was going into a mall, which is in downtown Paterson.
Right, I know the area.
So, but we also looked at, we're coming out of this economic recession. We have to take a fresh look at who we are and how we serve the community. And that's what caused me to say yes. It was the benefit to the community and the impact in the community.
By the way, sorry for interrupting. Explain to folks what the larger benefit was to the community.
The larger benefit to the community was two things. One, it put an anchor in the mall. The mall was struggling somewhat, so put an anchor right on the corner in the mall, which was close to state offices and county offices and city offices, so that was critical. What it also did was it created jobs. You know, when we look at our cities, we all want to say we started out as Steve Adubato and Leslie Anderson, but we didn't start there. So these jobs give you the opportunity to get some work, get some skills, you know, build up your resume so that you can go for those bigger jobs. So that was the other piece to the IHOP. And the greater piece was the support from the IHOP itself. IHOP wanted to help the franchisee go there. So that was the other motivating factor for our decision.
By the way, Leslie, it's important that people know, where does the money come from for the authority?
Oh, you are so in my space today.
It's a money question, because people are like, hey, where's that money come from?
Exactly. So in 1996, the New Jersey Urban Redevelopment Act was passed.
The legislature passed it, governor signed it.
Yes. We received a $9 million appropriation to start the Redevelopment Authority. In 2002, we received another $25 million appropriation for the Urban Site Acquisition Program. Since that time, we've gotten no additional appropriations from the state. Right. No, it's not flat. But we have to invest. We have to invest wisely. We get repaid through our loans, and that's how we fund ourselves. So since inception in 1996 to now, we've approved $418 million in investments, and we've leveraged $3.8 billion. So,
whoa. That investment turned into how much?
$418 million in improved investments, and we've leveraged with other state agencies, with private sector investment, $3.8 billion of projects in New Jersey's most distressed communities.
Outside of Patterson, I mean, we're taping in the beautiful Agnes Varus studio right here in the heart of Newark, New Jersey at NJTV. Newark projects as well.
Absolutely. I'm excited right now about Rector Street. We have invested in that project. We also have a special subsidiary for Newark called Working in Newark Neighborhoods. We invest those resources in neighborhood development projects, smaller projects.
What's going on, Rutgers? Is it spelled right? Is it Rutgers Street or Rector Street? That's what I thought. It's also part of the downtown area.
Yes.
What's going on there?
We're going to see for the first time some market rate housing go into downtown with a mix of affordable units as well. And what we're going to see on the ground level, we just had a meeting earlier. We're hoping to see a restaurateur who had to shut down for a minute, but is going to reopen her location at that Rector Street
And
location.
they do well, Leslie.
Yes.
Some dollars come back to the authority?
They repay. So we're a bank. That's the easiest way to say it. We're a bank.
But a bank with a specific mission.
We have a mission to redevelop New Jersey's urban areas. We have a mission to have a positive impact. We have a mission to invest in the community. And our terms are flexible, right? So we look at the project, we meet with the developer, we look at the project, and our terms fit and benefit the project. So we don't necessarily have the shareholders that the bank have that want a return on their investment. Our return on the investment is the improvement in the community, the job creation, the home ownership opportunities, the safer neighborhoods. That's where we make our difference.
How rewarding is this for you?
Tremendously rewarding. Because you want your legacy to be a reflection of your character and your values. And my work at the Redevelopment Authority shows that. I mean, I've invested all over the state, and sometimes I'm with my family and I ride by and I say, I invested in that. But you might see kids playing, you see people come out. We did a charter school also here in Newark Collegiate Academy.
You supported, you gave the loan to the charter school.
The bond financing to the developer.
Because they potentially would not have been able to get it.
Exactly.
I'm sorry.
So you meet the little girl who tells you while she's touring the school, I'm going to spend my spring break in France. And in order to be able to do that, I had to do a conversation for an hour in French. But I'm looking at the bricks and mortar and saying, I built that so she could go to France.
Wow.
And that's the rewarding part. And that's the legacy, because it'll be there forever.
Final question. How much does it matter who the next governor is? It's not even a political question. It's a policy question. Each governor, he or she decides what the priorities are. Does it matter who the governor is in terms of the work of this authority?
It's funny you ask that. We're celebrating 20 years.
Congratulations.
Thank you. We were established in 1997. So I don't want to be flippant.
Was that the
and
Whitman
say-
administration?
Yes.
Okay, go ahead.
I don't want to be flippant and say that the governor doesn't matter, but when you focus on the work in the community and you focus on creating the structure and the policy and the process, at the end of the day, if you follow the process, if you keep making an impact in the community, it's important to have good leadership, but at the same time, it's important to stay focused on your mission and what you need to get done.
Can we, Jackie, do you have the website? Jackie Heyer, our great senior producer here at State Affairs, our team is going to put up the website. As we put up the website, why is that relevant for any citizen in the state right now?
The
website, yeah. What do they learn from that website?
What they can get from that website, we offer classes on redevelopment, so they can get information there. They can get preliminary information about how our financing products work, so they can get that initial information. They can figure out how to contact me. I'm on with you today, but how do I contact her if I want to make a difference in my community? And you reach out to us. All of our contact information is there, and you can also see our success stories.
Leslie Anderson, Executive Director of the New Jersey Redevelopment Authority, attempting to make a difference, particularly in distressed urban communities every day. I want to thank you for joining us.
Thank you, Steve,
on public
for having
television,
me.
FiOS,
I
and everywhere
appreciate
else on State of Affairs. Thank you. I appreciate it, Leslie. We'll be right back right after this. We're going to a very different but important segment. New Jersey is about to elect a new governor. This fall, I'll be sitting down with Democratic candidate Phil Murphy and Republican candidate Kim Guadagno. So what do you think the #1 challenge is facing New Jersey's next governor? Share your thoughts with me on Twitter at Steve Adubato. Do it now. Let your voice be heard, because democracy is not a spectator sport. State of Affairs is pleased to welcome Dr. Ben Evans, president of the New Jersey State Nurses Association. Good to see you, Ben.
Good to see you, Steve.
Nursing profession is changing every day in so many interesting ways. Biggest change you've seen in the last 5 years is?
A move towards quality and a greater push for staffing accountability, I think.
What does that mean?
Well, patient safety and patient outcomes are driven by how we staff in healthcare settings. And so there's a push to make sure that we have enough qualified staff taking care of the patients to ensure quality outcomes.
So interesting. We've talked about this before. To disclose, the Nurses Association is one of the underwriters of our programming here at the Caucus Educational Corporation. But one of the things I've learned in some of our past programs is that a nurse is not a nurse, meaning it's not just every category. So I want you to help us on this.
Okay.
A registered nurse versus an advanced practice nurse.
Registered nurse has basic generalist education across a broad scope of discipline. They're licensed by the state of New Jersey, and they direct the nursing care of patients. An advanced practice nurse is someone who is prepared at the master's or doctoral level in a specialty area of care, and they can prescribe and manage healthcare conditions for individuals.
So as we talked to Ben, we're going into the summer of 2017. We don't know what's going to happen in Washington regarding the Affordable Care Act, the Trump administration, Republican Congress talking about. We don't know. But the Affordable Care Act did do very specific things, Dr. Evans. Excuse my voice. Good thing doctors and nurses are in the House. So they did many things as it relates to the role of nurses. Did it expect more from nurses?
I believe since 2010, when the Institute of Medicine put out its landmark publication, The Future of Nursing, it called for nurses to practice to the full extent of their education. There's been some changes in movement in that. The VA has recently expanded the role of APNs within their
The Veterans Administration?
Veterans Administration, yes, has expanded their role. 17 states have done away with collaborative agreements. So we're moving.
Whoa, what does that mean?
Well,
collaborative agreement.
A collaborative agreement is an agreement between a nurse and a physician that allows the nurse to prescribe. It is not a supervisory agreement. It is simply a collaborative agreement where a nurse can contact a physician in their specialty who has agreed to work with them and give them some guidance if needed.
So what's happening with that?
In New Jersey, we have the collaborative agreement going on. 17 other states have gotten rid of that. It's sort of a hindrance to access to care.
So interesting as we talk about this. We're doing this in the context of a significant race for governor in the state of New Jersey. There will be a new governor in January of 2018 that follows up after Chris Christie. How much does it matter, Ben, who the governor is and what he or she thinks of and what the policies are regarding the nursing profession?
Well, we have a lot of folks who make regulations around nursing profession without ever consulting nurses. They're
How dare
legislators.
they?
Yes, right?
Legislators and others.
Right. And they come from business, they come from law, but they do not come from the discipline of nursing, very few. We have a couple in the state who are registered nurses, advanced practice nurses.
By the way, we've had here Nancy Munoz, a registered nurse who is a member of the state legislature, I believe, from Union County. Is there another one? I think there is.
There is. I believe there are two others.
It doesn't matter who they are. By the way, we'll check it out. Look on our website. We'll tell you who they are. Why is that problematic if you have non-nurses making policy regarding nurses?
Well, we know what the care needs and care requirements are for our patients. If someone is working on a staffing ratio versus a staffing acuity mix, you could throw bodies at bodies. That doesn't mean you're going to have quality care. 2 new graduates taking care of 10 acute patients is not the same level of expertise and quality as perhaps one seasoned nurse with many years' experience and one new graduate taking care of those same set of patients. And so you have a mentoring type relationship, a little bit of experience to fall back on. So nurses have a feel for patient care needs, they have a feel for what nursing workload is like, and it's very important that we be at the table to express what it is that our profession does and needs.
Ben, let's move from New Jersey to Washington. We are not going to debate or discuss in detail what is potentially going to happen in Washington, but how much does it matter what the president and the Republican Congress, Republican-led Congress, I should say that, what they do or don't do as it relates to the Affordable Care Act vis-a-vis the nursing profession? Can they impact it directly?
Absolutely.
How?
You can take away funding for programs, which then limit staffing. You can take away equipment or program funding, and
The federal government can do that.
you can limit DME, durable medical equipment, prescribers. For a while, nurses could not prescribe durable medical equipment. That's an access to care issue. So now we impact the consumer or the patient themselves. There are restrictions, and as we're not at the table, those things are missed.
That concerns you.
It does.
What impact do you think it could have on patients? I mean, this program is for patients, consumers, viewers of public broadcasting, FiOS, other places who watch us. Your patients, your prospective patients, your families are patients. What could it mean to patients?
Well, it could mean that anyone that walks into your room is considered a nurse, which is not true. If you have not been to nursing school, you are not a nurse if you're not licensed as such. And so you could be in an agency or a facility that is staffing with non-nurses to provide nursing care.
How would the consumer know that?
They would have to ask. And if the person illegally identifies themselves or just says, I'm the nurse, well, there's no protection for that.
Ben, go back on something. Does that person who walks into the hospital room or any room where clinical medical care is taking place, does that person have a legal responsibility to announce who they are?
You should always introduce yourself and what your role is, but that doesn't mean that that's always done.
More and more, with our physician shortage, particularly as it relates to primary care physicians, is it fair to say, Dr. Evans, that more and more is expected of nursing and nurses than ever before?
I think that the area of growth for that is in the advanced practice area. Advanced practice nurses look at, they are certified in a specific area.
Right.
There are adult gero nurse practitioners, family nurse practitioners, women's health nurse practitioners. These individuals who are trained and board certified at the advanced level are then filling in some of the areas where we're seeing shortages of physicians, especially in the family practice area.
And some of them are going for their PhD.
Yes.
And why would that matter?
Well, doctoral education is the top rung of any form of education.
A doctorate in nursing.
A doctorate in nursing. So you could have a PhD in nursing, or you can have an EDD, which is an education doctorate in nursing, or we have the Doctor of Nursing Practice, which is a practice doctorate, and it focuses on leadership, change, and quality for nurses at the advanced level.
And we need more and more professors of nursing
Absolutely.
in nursing
There's
schools, right?
Absolutely. The graying of the faculty is a real concern, and so we are looking at recruiting in to get more faculty.
And you've not that you're part of the graying, but you've been teaching for a couple of years in
I'm
nursing?
36, I think.
Okay, listen, I get so caught up in my conversation with Ben. Ben Evans, who is the president of the New Jersey State Nurses Association. That's it for this particular edition of State of Affairs. Let's continue the conversation. I will get this out. Follow me on Twitter. You see it? It's at Steve Adubato. We'll see you next week.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris and JTV studio at 2 Gateway. Funding has been provided by Johnson & Johnson, Wells Fargo, Holy Name Medical Center in Teaneck, New Jersey, PSE&G, Bergen Community College, New Jersey Council of County Colleges, and by MD Advantage Insurance Company of New Jersey. Promotional support provided by the New Jersey Business and Industry Association and by NJ Advance Media.
What is it?
It's you.
It's me? All right, Emma. I know it's not your favorite, but it's time for your medicine, okay? You ready? 1, 2, 3. Emma, Emma, Bobemma, banana, fana, fofemma, fee, fi, fofemma, Emma. Very good, sweetie. How do you feel?
Good.
Yeah, you did a really good job, okay? Let's go back to drawing.